welcome to our Friday afternoon. This event is organized by GW Office of Integrative Medicine, who's the leading academic resource for integrative medicine, as well as AIM Health Institute, DC 501c3, providing holistic and integrative services for those less fortunate and near the end of life. So with that, as you can see, Giants is on the road, so we will be starting a little late today. Apologies for that. We have a busy agenda. You know the drill. Questions go in the chat. I have some updates as well as a little bit of a wellness talk. So let's start with updates. Main thing, if you're worried that your free tests that I hope everybody by now ordered and received are going to get expired, because that's what we just got messaged from CDC. Don't worry much about that. I think the tests are going to be good for quite some time after expiration date. I think I already brought this up before, but I just want to repeat that. As long as the control on the test works, it means that the test works, and you don't need to worry about proceeding. So you can just use it. You do get a total of 4 tests, but it's only 2 boxes of 2 tests each. How often they will allow us to do that, who knows? But anyway, it's at least for starters. Last week, CDC approved combination of a rapid COVID and flu test. I don't think these tests are going to be free. My understanding, they're going to be about $30 a piece. There are going to be 2 of them in a box, so it's a $15 roughly. I'm guessing lots of people would like those because they are, I mean, it sort of makes a good sense, right? Because the symptoms between flu and COVID can be very, very similar. So it's a kind of a nice thing to test for both conditions at the same time. So I haven't purchased any yet. I haven't tried them. I don't know how they work. If anybody have, please by all means put something in the chat, and we'll let you unmute and tell us what your experience has been. So that's quick updates. COVID is continuously going down, which is a good thing. We have not seen pretty much any flu or respiratory virus or RSV at all so far. Also good news. Again, we're still not yet in November, so it's kind of early to say what the season's going to look like. But I think it's probably safe to say we're not going to have some really, really bad season, simply because usually the bad seasons tend to start a bit earlier. So hopefully in terms of flu and RSV, it's just going to be a regular year similar to the last year, which last year was relatively mild. In fact, I was just reading some news basically saying we have a milder season period. Not exactly clear why. Maybe it's because the weather has been nicer. We've been more outside, less indoors. But yeah, we'll see. The future will show. So that's just the general COVID updates. I don't have any updates on the strains, and I also don't have any other updates on vaccine. Of course, you may have seen today or yesterday, CDC put out yet another recommendation to vaccinate every 6 months for those over 65 and or at higher risk. What they're basing it on, I don't know. I disagree with that. You all know my position. I am not necessarily going to trust anything CDC says. I'm going to carefully look at the evidence and try to come up with my own personal opinion, as long as it sort of goes in some line with the standard recommendations and it makes sense. So that's that. If you've been seeing news about side effects, I promise that I will at some point analyze this study on side effects, that the largest study published from UK on over 1 million injections. I haven't done that yet, so it's on my to-do list. I actually have been quite busy with the podcasts. So what I will do is, I don't know if I talked about my recent podcast. So that's what partially what I'm doing today. So first thing what I'm gonna do is I don't think it makes sense to share the screen. I'm just gonna give you a link. I think that would just go easier. And so there were several podcasts of lately. I think the most recent one that I just put out 8 days ago is on what's something called visceral manipulation. I am absolutely sure, and I don't know, Janet probably cannot hear us because she's driving, but she may confirm. But we will have this practitioner soon with us to discuss something called visceral manipulation, which I highly recommend anybody with any chronic abdominal pain or symptoms to check out. It's a very effective osteopathic manipulation treatment. It's kind of similar to craniosacral therapy in the sense of how the tissues are sensed, but it is a direct force. I did personally, if you go and watch this podcast, I talk a lot about my personal experience there because I actually did that. So I went to my regular physical therapist, and she snuck out this practitioner who I'm interviewing into the room, and they worked on me together. And I will tell you, there was quite a significant change in how I felt. So this very how would I put it? Strange looking modalities, sometimes they're profoundly beneficial and effective. And it takes a little bit of faith here to sort of go into and try to understand what's happening, because it's not obvious for a lot of us to sort of realize that, yes, some people can actually sense your organs in the great detail through their fingertips. And I'm not afraid of saying that because I've also done some workshops and some teachings or some learnings where I have felt things that I would say my kind of Western mind would say, how is this possible? Because the tissue is so fine and so subtle. How can we sense this? But we can. I think our perceptual awareness goes way far beyond what the typical teachings are in a medical school. And so I've stopped being surprised by things like this. I think they are very profoundly effective, and not just because the practitioners will sense your organs, but because they can sometimes sense it a lot better than any imaging can. Problem with pretty much every single current modality, when you do the image, it's a 2D. So your organs cannot be assessed effectively. They can only be assessed for a particular pathology. But if your organ is in 3D position, slightly off kilt, it could be completely normal on radiology, while the visceral manipulation therapist would sense that. So this is something quite profound. Generally, it's not a covered service. I will give you sort of heads up. Unless the person who does this is an osteopath who would accept the insurance, I'm not aware of anybody in this area who would do that, but theoretically that's possible. Mary Ellen, who I interviewed this video, she's a actual physical therapist, but their practice Thrive Again, they don't participate with insurances, although they will give you a super bill and you can submit. So I just want to give you a heads up on that. All right, so that's all I have to say about this last video. Next week, early next week, I'm posting very interesting updates on some Maryland developments. So those of you who live in Maryland, there's quite a significant amount of interest in passing legalizing psychedelics in Maryland. So I interviewed an expert. She goes by the name Nurse Laura, who's on a psychedelic panel that was created by Maryland governor to advise how to proceed with the legalization. So I'm interviewing her. There's a little bit of conversation about that. The same video also talks about cannabis for PTSD and the current study that Laura has set up to do. So those are some of the upcoming videos and some of the updates there. Let's take time for questions, and then I have one other topic, but if we don't get to it, that will be perfectly fine because I can do that next time. And I know I still owe you guys conversation about side effects and sort of the frequency and the meaning of that, which I will be doing at some point in more detail. I mentioned that study, but I didn't discuss that in detail. Okay, are any comments updated pneumococcal wax starting at age of 50? Dennis, I think you need to clarify the question. So there's been an update about 2 or 3 years ago. I'm not familiar with change. There's a new vaccine that was introduced. Now it's recommended for everybody. If you just go to the CDC, type in CDC pneumovax, you'll get that information immediately. If you had a pneumococcal vaccine about 5 to 10 years ago, yes, it would be worth to getting this new one. It's only one-time shot. If you already have the new one, then pretty much that is all for now. I'm guessing that there's going to be some updates in some years. They tend to track the types of pneumococcal strains that are going around. You know, every bacteria and every virus mutates, right? So there's an expectation that there, for certain types of infections, there's going to be updates in vaccines periodically. They get better, they remove some prior strains, they add some new ones. So this is what this particular question sort of asks.
Yeah, this, Misha, this was about, from the CDC again, sorry.
Mm-hmm.
So the typical age range for pneumococcal vaccines is 65, correct? So they've dropped that.
No, I think, yeah, they changed that sort of. They basically said, before they were restricting it, they were saying, look, unless you're working in the in the healthcare field or you're at the high risk for some disease, we don't recommend. Now I think they're recommending over 50. That's not necessarily changing how I look at it, but honestly, this is one of those vaccines that's probably best to be guided by your doc if you are 65. Because they sort of say we recommend, but we also recommend to talk to a physician. This is not a blank statement compared to.
Sure, of course, absolutely. And they were discussing the 15, 20, and 21, as well as the PPSV 23. So.
Right. Well, that's the point. So everybody, the point that Dennis is making, there are different vaccines that cover different strains of pneumococcus, in the pneumonia-causing bacteria, let's just say it that way. And by the way, it's by far not everything is covered by this vaccine. So you understand the pneumonia can be caused by, I don't know, half a dozen, if not more, different types of bacteria. This only covers one particular most common one, doesn't mean that it covers everything.
Just like the HPV vaccine.
Pretty much. That's exactly right. And then it also covers different strains within that bacteria, but it doesn't cover, say, Klebsiella pneumonia, which would be completely different. But those are pretty uncommon. So there's very specific frequencies for each of those infections. And so it just doesn't make sense to make a vaccine for something that's quite uncommon and it's not necessarily more severe. So they tend to cover things that are, you know, there's a lot of public health goes into this, calculating risks based and statistics based on sort of how many lives and suffering will particular interventions save, because you can, you know, you can't really go after completely everything due to the cost limit probabilities and simply just.
Thank you. Appreciate it.
Yeah. No, it's a great question. Thank you. Yeah, it's actually a good question for good point for everybody. If you don't know if you're over 65 and you don't know your pneumonia vaccine status, it's probably a good idea to talk to your doctor. I will just put it this way, because, you know, it's actually, believe it or not, we're talking about RSV this season everywhere, right? You turn on TV, there's a RSV commercials, RSV vaccine commercials everywhere. The funny part is that, again, RSV does kill some people, so does flu, but it's way less frequent than pneumonia. I mean, pneumonia kills way more people, actually, because it's a lot more common. Infections tend to be quite severe, and yes, we can intervene with antibiotics, and we usually do. But sometimes it gets missed. Sometimes patients progress very rapidly. By the time they show up in the hospital, they're so sick that it's not always enough to just give antibiotics. And if it develops into sepsis or septic shock, you're just maybe too late to do anything at that point. So So the pneumonia tends to be more concerning when it's bacterial generally compared to viral. Viruses tend to be, they just don't necessarily become as virulent.
And apparently there is a rise worldwide for pneumonia. Yep.
I think generally
hospitalizations related to pneumonia.
hospitalizations, yeah, I think hospitalizations. I think it's probably related to the fact, again, that generally population gets a bit older and sicker. I think I've seen statistics saying that the highest rate of increase in pneumonia is in the developed countries, where we're still seeing total number of aging population increasing. Even if life expectancy doesn't increase, it doesn't mean that the general age of the median age of a population does increase. It actually does. That because we generally have more people surviving longer, not necessarily way past the, say, life expectancy, but before we had a lot of people who would be passing early from accidents, infections, etc. So I think we're simply seeing death related to the diseases that are much more common in aging, obviously dragging the statistics upwards for this particular reason. So, okay, great question, great discussion. Thank you, Dennis. Okay, what is this? I've already gotten a sneaky cold that started out mild and then degenerated into very long-lasting cough, similar to milder version among younger family members. Okay, so that's not pneumonia. So this is a common cold that was going around, some this nasty, some kind of a, what we often define as URI, upper respiratory infection. I don't think it's RSV. We've seen a lot of people do this bronchitis kind of picture for many weeks and months. I still have some people who picked it up in August calling me saying, I'm still coughing, I'm better, but I'm still coughing. This is the problem. I mean, sometimes the summer infections and the early fall infections, even though they're completely benign, they turn into this. The best thing I would suggest to everybody, do two things. Well, one, if you know this is coming, right? Try to strengthen your pulmonary system. So devices like incentive spirometer, the one that I love the most called Breather, it's a new type. I think I'm actually going to put Amazon link. I hope nobody doesn't mind Amazon. So if you don't buy stuff on Amazon, I'm sorry, it's just easier for me. I'm sure I'm sure company has its own website, but there are probably also a lot of mimicking products. It's a very simple device. It's been, they created this device some years ago. Prior, most of the incentive spirometers looked like this little, like a box with a clear box inside that you would have 3 or 4 compartments with balls going up when you take a deep breath through the pipe. This one is completely different. I'm getting link. Let's see if that link's gonna work. Okay. Nope, sorry, 1 second. Kind of hard to talk and then do something in here. All right, there we go. So that's the link to the actual breather. So it looks like a little tube. At the end of a tube, you have some dials. It's pretty sophisticated device, though, even though it looks pretty simple. It's very small. It's easy to fit into any little bag. You can actually connect it to your phone if you care. You can also just use it purely manually. And it's used heavily by athletes. So what it does, it not only helps you to expand the lungs when you have cough, when you have something acute going on. It actually helps you to expand the lungs even when you're completely healthy. So it's one of many ways to work on increasing lung capacities, particularly what we sometimes call a vital capacity, which is a typical amount of air going in and out. So you actually can make your breath deeper. You don't have to do it with device. I think we have talked about this book called Breath by James Nestor. And I mentioned that book quite several times. There are several techniques. For example, Buteyko breathing is one. There are several others listed in the book where you can do that. Device tends to achieve some of this effect faster. And whenever you're actually sick, you're not going to sit there and try to learn Buteyko method. It's a whole lot easier for you to simply engage into using a device, which is much quicker and easier. Now, the old devices, which is I'm also going to show you since we're talking about this. So actually, it's really important for this time because it's a season where most of us will get something. Let me give you something that looks good. So something like this would be, so this is an old style. If you ever end up in a hospital, oh, sorry, I think I just doubled, same, ignore that link I just sent. I have to give you a different, okay, this one. So if you end up in a hospital, you would get something like this second one. They're very cheap. They're like 10, 20 bucks or even less. And the second one is very simple. They will just set up some goal for you and say, breathe in 10 times once every hour, deep, drag it in. So when you take a deep breath through the more resistance, you tend to generally simply expand the lungs more. And if you do it repetitively, you end up training the muscles of the lungs to stay a little bit more open. And also, if there is any parts of the lung that collapsed, it's called atelectasis, and it actually happens quite a lot. Parts of the lung, when you're coughing, when you have infection, it may collapse under the weight of infection. It's not a problem. It doesn't mean that it's kind of permanent. Actually, the lungs always will re-expand. But you can try to expedite this process, so you can use this device. So have something like this in the house, whether you choose to have a breather or you choose to have the other one. I frankly don't think there's a sort of a clear evidence. The reason breather has been pushed so much because actually they've done double-blind randomized control study. Now, I don't know how it was double-blind. It probably was single-blinded because obviously devices look a bit different. So they actually show that their device tends to work, and it's an FDA-approved device. Why the hospitals still use the old type, the one that's the second link, it's just difference in price. You know, the hospitals has been using these devices for many, many, many decades. Okay, any questions on this? This is a great topic, by the way. The how do you treat cough and what you can do for it? You absolutely can take medications. So this Advair is a very common medication that's used for bronchitis. I would also suggest looking into herbs for cough. I love this product called Wise Women CE 1 or 2. So it's a cough elixir. And one has honey, one does not. So if you're diabetic, you would get CE2 rather than CE1. Dose is a half a teaspoon or a teaspoon a couple times a day or as needed. It's a little bit better than things like Robitussin because the problem with something like Robitussin, you don't want to suppress the cough. What you want to do, you want to expirate, so you want to loosen up the secretion and cough them out. That will expedite the recovery or shorten the bronchitis. I think I think the cough syrup, the herbal syrups will be helpful in any scenario. In asthmatics, if acute asthma, it probably won't do much because you need bronchodilation. These things do have some bronchodilatory effects, but they're very mild. So I would probably not try to experiment with this, but I definitely would experiment with the cough syrup if you're having a chronic bronchitis. It's marshmallow root. Boy, I probably should Google it so that I don't tell you what herbs. It's a combination product that is really gentle and nice. But generally, there are lots of other products like this. It's cough elixir. That's what CE stands for. All right. So I'm gonna tell you exactly what. Usually, if you're my patient and you want to get this, let me know. I'm happy to put the order through FullScript. But here's the actual link to the product itself directly out of the manufacturing website. And I don't necessarily, they said that it's out of stock there, but again, you can buy it on FullScript. So it's marshmallow mullein. That's why I was looking for that word. So mullein is really, really good. Fennel licorice. orange peel osha propolis. That's one of my favorite. Now this one does have honey, and there is a little bit of alcohol just as a preservative, so the product stays on the shelf for a long time. So gentle product. Again, all of these herbs have some value in being supportive for the cough. And the most aggressive method that we use all the time, I'll type this just so you don't wonder about spelling. It's a glutathione inhaled through nebulizer. Now, this requires prescription. This requires getting glutathione, which is usually comes from pharmacy, but from compounding pharmacy. It's the same glutathione we infuse through the veins, but it's a great method for cough. Especially for cough in an acute scenario. So when somebody having this acute either allergic reaction or asthmatic reaction or viral infection, probably even bacterial, it's a great supportive care. So I've had a lot of patients who would have this bad cough rapidly improve with this method. It's a bit pricey. You have to have a nebulizer. I have a video on our YouTube channel that explains and shows in detail how you do this, so you don't actually have to go to a practitioner or to a clinic to learn. Although, frankly, if you want to, that's fine too. We do often bring people into the practice who kind of want to have this done first to them in an office. That's perfectly fine. But here's the video that shows how to do this. It's a great topic. I wasn't planning on covering it today, but I was planning on doing it at some point. What do you do with a cough? So now we did. All right, let's take maybe 1 or 2 minutes more for questions, and then so we have full 20 minutes for practice. All right. Let's see, where was I? I think so. We talked about cough. Oh yeah, and that's it, right? Okay. So I think Linda's question next, I think. Oh, there are visceral manipulation therapists at GW Rehab, really? I have a hard time believing that. It's a very unique method. It's never covered by insurances. Really interested to know who these people are. I mean, theoretically, physical therapists can bill insurance for anything they do under scope of their license. It's problem with documentation. They have to document what they've done. So if they spend an entire half an hour doing visceral manipulation, I don't know how they can document that and get paid for something else. But if that's the case, I would be really curious to see who that is. Yeah, correct. It's well, yes and no. So it's actually does not need to be added to the PT therapy. It's actually an osteopathic method. So it can be added to anybody. Even massage therapists can take visceral manipulation courses. Most of them probably split between osteopaths and physical therapists. But I had no idea that somebody in GW trained in it. I would find it pretty surprising. But okay, that's great if that's the case. Okay, so Linda's asking, how has your healing progression since your well, so the main thing that I noticed that there was I mean, I always have a little bit of IBS, not based in change in bowels, but more of bloating and gassiness. And sometimes that would cause discomfort, and more importantly, it always felt that there was some degree of backup, if you will. And so what Mary Ellen said she worked on a diaphragm, which released significant amount of, I guess my peristalsis improved. So I've been noticing just generally digestion is way better overall, period. And all symptoms. I wouldn't say that something specifically gotten a whole lot better. I just feel that it takes me so we went out to a friend's birthday yesterday. There was this great pizza. I said, okay, I'm not gluten-free for tonight. So I had the 2 slices. And so, yeah, I was a little bit bloated as I would, of course, but it's way less than I was expecting the next day, right? So I know what I would pay for, but I paid way less for it than usual. So I'm noticing an improvement for sure. and I've only had one session, just so you guys know. And by the way, Dennis, this is for you. That inhaled glutathione is one of the most profound methods for asthma for patients who never try that. I've had several asthmatics who basically nearly completely managed their acute episodes with this without use of drugs.
Awesome. Thank you.
Yeah, the only thing I would warn everybody, it's like walking into a hell because it smells like hell. I'm not kidding. Glutathione is a sulfur molecule, so it smells like rotten eggs up your airways, inhaling deeply. So it's a little bit of a custom process. But frankly, I'm yet to hear from anybody who would say, "Oh, I can't do it because of that." It's actually kind of a
relief. That should not be a problem.
It's not just that. It's like, how would I explain? Because it's not psychologically affiliated with seeing something dying or something nasty. It's just the smell, and it's actually not. It doesn't cause nausea. It doesn't cause any physical sensation. You just kind of, okay, well, it's just the smell of that particular biologic molecule. It's funny how we associate this smells with like something really awful, but in reality, sulfur molecules are critical for our living. They're very important molecules. They involved in detoxification. They involved in all kinds of processes. They're critical. We're supposed to eat a lot of foods that are high in sulfur, like onions and garlic, and yet there's this sort of you eat a lot of garlic so you don't end up being eaten by a vampire, but you still end up in hell because eventually you stink like one. Like there's this cultural funny disconnect here, which I always find entertaining for me. But okay, all right, we're a little bit over, so let's wrap up the Q&A. All right, so, and by the way, if anybody interested where we went to this little place called Coma. It's this new place in Tacoma Park. It's an Italian bistro. They're also owners of a couple other restaurants. I think they own a few other places. I think they own Motorcat in Tacoma Park. And I think they also owned this new place that's on, anyway, doesn't matter. I forgot the name of it. So let's wind up, and I have a little bit of a special practice prepared for us. So let's everybody get comfortable. And this is it's a compassion, loving kindness Buddhist meditation. I think many of you are probably familiar with that, but I find we're in a time where I think a little bit of a loathing and a positivity and developing self-compassion as well, compassion to others can't hurt, especially anticipating what's coming in a couple of weeks. I think we're all going to be under tremendous stress. So, we're not doing politics on this podcast, but we have to talk about the fact that elections are in just a couple of weeks. And so, yeah, and, if you see Jennifer trying to pull out her hair, don't do that. Point being is we'll survive, we'll move on, we'll meditate through, we'll adjust to whatever happens. And I think whatever happens is something we're going to have to live with. So what is better than keeping locus of control to what we can do? And what we can do is to make sure that we keep our ground, we stand strong, we keep compassion inside of us no matter what happens, so that whatever the forces are that are trying to unground and throw us off don't achieve that, and that no matter what happens, whatever the politics bring, and whatever the environment around us feel, whatever that drama is, ultimately we don't have to be part of that. We can be observers, we can participate in it from perspective of feeling something about it and agreeing or disagreeing with it. But ultimately, I think our spirit is always deeper. I love to compare this to an ocean. This is just when I get a text, those texts that says Trump is, if everyone reading this pledges to vote Trump will beat Kamala in landslide. And then I'm sure in a couple of minutes I'll get the reverse message. How did they get my phone? I have no idea. Especially since definitely I don't know how is that the Republicans got my number, since I always vote Democrat. So what's up with that? I have no idea. But anyway, it's good. So if that doesn't causes the stress, right? If that doesn't throw you off of your energetic footprint, and then your internal attunement stays strong, it stays balanced, and more importantly, it stays true to who you are. I think if that's the, if you can achieve that through practices, I think that's really the goal. So without further ado, we have about 15 minutes, which we will start. You can do this with eyes open or closed. I think I'm part of this is me reading the text, so I'll keep my eyes open, but if you feel more comfortable, you can lay down, but generally it's recommended to do this more of a seated. But if you feel tired, by all means, if you need to lay down, it's perfectly fine. So let's first just shake a little bit, maybe roll your shoulders, roll your neck, just to kind of adjust to be a little bit more in line with body, more comfortable. So now if you feel like to go ahead and gently close your eyes, otherwise just kind of have a soft downward gaze. Maybe you want a couple of feet away from wherever you're sitting. So now put your hands over your heart. You can do one hand or both hands like this. And by doing this, we're beginning to bring our attention to the heart, to the physical place where we kind of connect to our emotions and our emotional experiences. You can feel the warmth of your hand, the pressure. You're going to feel your chest rises and falls with each breath. So now lower your hands, but still feel that sensation of middle of the chest, the sensation of your heart. So in this practice, we're cultivating loving kindness to ourselves, to all those that who we call friends, but to everyone else, no matter whether we perceive positivity or negativity toward this particular individual or creature or whatever, whoever. So the idea is that this is boosting our own capacity to experience loving kindness and grow compassion, regardless of the environment we're in. Now, allow yourself to remember and open up to your basic goodness. You might remember times you have been kind or generous to yourself or others. You might recall your natural desire to be happy and healthy. If acknowledging your own goodness is challenging, look at yourself through the eyes of someone else who loves you, someone who's close to you. Well, what does that person love about you? Or alternatively, you may recall the unconditional love you felt from a beloved pet, your loved one, or a close friend. As you experience this love, notice how you feel in your body. Maybe you feel some warmth. Maybe there's a smile crosses your face. Maybe it's just a sense of expansiveness. This is a natural feeling. This is the loving kindness. So this is that feeling of being in love, in unconditional love. So let's just take a few breaths here, resting in this feeling. Now imagine that each breath you take brings even more loving kindness into you, inviting deeper peace, deeper acceptance. And then when we breathe out, we exchange it back into the environment. So this is not a single one-way street. This is a two-way street. We breathe in loving kindness. We breathe out loving kindness. So we increase our capacity while maintaining the balance, while giving this positivity to everything around us too. Now we will be repeating actually with the voice, a couple of sentences. Now this one's a typical ones. You don't have to follow that. If you have the ones you like, by all means, you can use them. Or you can simply follow. Please make sure you mute it. Otherwise, we're going to have a nice, loving cacophony. And if you're going to, I'll send a copy of this practice to everybody at the end. If you choose to do this at home, it's always recommended that you speak these words. I think the verbalization, outward expression enhances the capacity. So let's begin. And we do every part 3 times. May I be happy. May I be healthy. May I be safe. May I live with ease. 2 more times. May I be happy. May I be healthy. May I be safe. May I live with ease. May I be happy. May I be healthy. May I be safe. May I live with ease. Let's take a breath here. And now let's open the circle of this loving kindness by bringing to mind a benefactor, someone who has benefited you, whether you know them or not. Maybe it's someone you love, someone close to you. Maybe it is someone you deeply care. Maybe it's just your hero who supported you without knowing that this person does. Or maybe it's someone you deeply trust. Reflect on this person's basic goodness and sensing what it is in particular that you love about them. In your heart, feel your appreciation for this dear one and begin your simple offering. May you be happy. May you be healthy. May you be safe. May you live with ease. May you be happy. May you be healthy. May you be safe. May you live with ease. May you be happy. May you be healthy. May you be safe. May you live with ease. Okay, so this is the easy part. Now we're moving to part that's getting a little bit more difficult. But let's move forward. So now bring to mind a neutral person. So this may be someone you see a lot, but you don't know them well and they don't know you well. Maybe it's your neighbor. Maybe it's a grocery store clerk or someone you pass every day and you just really don't know them and don't interact with them. As you bring this person into your mind, begin to repeat the same words. So let's take a breath, prepare, and begin. May you be happy. May you be healthy. May you be safe. May you live with ease. May you be happy. May you be healthy. May you be safe. May you live with ease. May you be happy. May you be healthy. May you be safe. May you live with ease. Okay, let's take a breath here. Okay, so now this is the obviously more difficult part. So now we're going to turn our attention to someone with whom we're having difficult relationship. Could be someone that's part of your family. Maybe it's a colleague at work. You can look at this any way you want. It could also just be a person who causes you the most anxiety or the most perceived amount of stress in your life. So anything that whenever that person's image comes to you, you feel uncomfortable, you feel stressed, you feel anxious. So, and don't overthink this. I suggest that it kind of probably doesn't matter who the person is. The point of this is to feel that same positivity and this compassion and loving kindness, regardless of what traditionally this individual is generated in you. Okay. So I'm going to give you a second to settle on this. This is obviously more difficult. Okay, and then let's begin. May you be happy. May you be healthy. May you be safe. May you live with ease. May you be happy. May you be healthy. May you be safe. May you live with ease. One more time. May you be happy. May you be healthy. May you be safe. May you live with ease. Okay. So now, instead of concentrating on a particular person, we're doing a more broad, so just a general, we dispersing our attention in all directions to ourselves, to the family, to the neighbors, to people in your city, to the whole world. You're just going to all around you, to all beings, alive or not alive. I mean, what is alive after all, right? So we're putting our attention onto the entire world that we live in. Wishing every creature richness, avoidance of hunger, abundance of blessings and joy. So let's begin. May we all be happy. May we all be healthy. May we all be safe. May we all live with ease. May we all be happy. May we all be healthy. May we all be safe. May we all live with ease. May we all be happy. May we all be healthy. May we all be safe. May we all live with ease. Before we close, we're going to come back to ourselves and do the practice one more time, just savoring the goodness of the practice, feeling the compassion flowing through our hearts, no matter what the circumstances are, even if they're difficult and hard to find goodness in them. May I be happy. May I be healthy. May I be safe. May I live with ease. May I be happy. May I be healthy. May I be safe. May I live with ease. May I be happy. May I be healthy. May I be safe. May I live with ease. Let's just take a couple more breaths. Slowly open your eyes. Back to the room. We'll see everybody next week. We have Catherine Miller. We've all seen her before many times. She's from For Direction as well as Center for Integrative Medicine. And she's going to be leading our mind-body practice. And I'll be with you as well. So we'll do, hopefully I will cover the side effects of vaccines, of the COVID vaccine by that time, or maybe I'll pick something else. We'll see. Let's see how things roll.
Thanks, Misha.
Safe weekend, everybody. Enjoy. It's gorgeous out there.
Dr. Kogan,
Hot.
I
Yes.
will be fine. This is Salome. I have an emergency.
All right, I'll stay here. And if anybody else need me, I'll stay here for a bit.
All right, Misha, I'm gonna make you the host and leave, okay?
And stop recording. I'll do that.
Yep, yes.